Welcome to Healthism. In today's video, we'll be discussing 7 warning signs of a stroke that may appear 1 month before it occurs. You're familiar with strokes, aren't you? Have you ever considered whether your body might show any signs, perhaps a month or a few months beforehand, indicating a potential stroke? If you notice any of the symptoms I'm about to discuss in this video, it's crucial to seek immediate medical attention. These signs could indicate that a stroke is imminent. These 7 signs could potentially appear as early as 1 month before a stroke occurs. Delaying diagnosis raises the risk of substantial brain damage. Stroke risk doesn't discriminate based on age, gender, or health status. Even among young or seemingly healthy individuals, cardiovascular diseases are increasing worldwide, including among younger people. Undoubtedly, this is the leading cause of death in the United States, with over 795,000 people suffering from a stroke every year. Nearly 159,000 Americans succumb to stroke annually. Stick around as today we delve into the 7 stroke symptoms that may manifest 1 month before the event occurs. You'll discover strategies to prevent this disease and steer clear of becoming part of this alarming statistic. To illustrate, many of the signs that appear a month before a stroke are subtle and often overlooked, which can lead to misinterpretation. It's crucial to recognize these signs, regardless of age, health status, or the presence of other medical conditions, as strokes can impact anyone. So, stay vigilant. Sharing this video with your family and friends could play a crucial role in saving lives. Furthermore, I'll clarify the differences between ischemic and hemorrhagic strokes, which will enhance your understanding of these conditions. Additionally, I'll discuss what a brain aneurysm is, including its warning signs. Most importantly, you'll gain insight into transient ischemic attacks, TAs, which can occur before a stroke. Identifying their signs and symptoms could potentially save your life or the life of a loved one. Keep in mind that if a first-degree relative has had a brain aneurysm, it's essential to consult a reputable neurologist for screening, even if there are no symptoms present. This proactive step is crucial for the early detection of potential brain conditions, alright? Now, let's delve into it. Discover the 7 signs or symptoms that may occur a month before a stroke. If you experience any of these, seek medical attention as soon as possible. Symptom number 1, consistently high blood pressure. Exploring consistently high blood pressure concerning stroke risk underscores the dangers associated with chronic hypertension. If left uncontrolled, it can significantly elevate the risk of experiencing a stroke. Blood pressure measures the force exerted by blood against the walls of our arteries. When this pressure increases, a condition known as hypertension, it poses significant health risks. This heightened pressure can inflict damage on the blood vessels, resulting in narrowing, weakening, or even rupture over time. All of these factors significantly contribute to the risk of stroke. If a blood vessel in the brain ruptures due to high blood pressure, it can lead to bleeding, resulting in a hemorrhagic stroke. Likewise, if high blood pressure damages arteries that supply blood to the brain, it can diminish blood flow or create an obstruction, leading to an ischemic stroke. Thus, it's crucial to manage hypertension. Embracing a healthier lifestyle and following prescribed medication regimens to control blood pressure are essential measures. Implementing these measures is crucial for reducing the risk of stroke and other cardiovascular diseases. 2. Excessive fatigue. Excessive fatigue or extreme tiredness can serve as a symptom or a warning sign preceding a stroke. It's important to keep in mind that fatigue can also stem from other causes. If you're encountering profound, persistent tiredness that deviates from your usual experience and isn't attributed to physical exertion or sleep deprivation, it could signal a warning. This heightened fatigue could be linked to alterations in blood flow to the brain. It might result from an artery narrowing due to atherosclerosis or the presence of a clot that hampers oxygen supply. Therefore, if you're experiencing an unusual level of tiredness, it's also advisable to seek medical evaluation. At times, extreme fatigue can precede a transient ischemic attack, TA, which indicates a temporary disruption in the brain's blood supply. A TA serves as a crucial warning sign, representing a temporary condition that could foreshadow an impending stroke. During a TA, Symptoms are transient and usually persist for a few minutes to several hours without resulting in permanent brain damage. Patients may encounter symptoms akin to those of a stroke, but these symptoms completely vanish within less than 24 hours. This typically happens when an artery in the brain experiences a temporary blockage. Within 24 hours, the body effectively dissolves the clot in the brain, thrombus, leading to the disappearance of symptoms. This swift resolution acts as a vital warning sign that a stroke could be imminent. Pay close attention to this, folks. If you notice any transient signs or symptoms, it's imperative to seek medical attention without delay. Symptom number 3, vision problems. Experiencing sudden changes in vision can serve as a warning sign. Blurry vision, double vision, eye problems, or difficulty focusing may indicate circulatory damage in the brain and serve as warning signs of a stroke. While there are multiple causes for vision problems, it's crucial not to dismiss these symptoms. Vision loss may occur due to the blockage of an artery supplying blood to the eye, often indicating an ischemic stroke, which is the most common type of stroke. Therefore, it's crucial to take such changes seriously and promptly seek medical evaluation. Symptom number 4, sudden and severe headache. A sudden and severe headache can precede a stroke. It's important to note that not all headaches are related to a stroke, and not all strokes are preceded by a headache. In an ischemic stroke, the headache occurs as a result of the obstruction of blood flow in the brain. When these headaches occur, they are typically described as severe and sudden. In a hemorrhagic stroke, characterized by bleeding within the brain, the intense headaches result from increased intracranial pressure due to the bleeding, which elevates brain pressure. Observers of stroke incidents frequently mention seeing the affected person grasping their head, showing signs of intense pain, and then losing consciousness. This reaction is especially prevalent in hemorrhagic strokes, where the headache experienced is often described as the most severe the person has ever felt. At times, a severe headache could also signal an imminent risk of an aneurysm rupture within the brain. Number 5, numbness or weakness in body extremities. Numbness or weakness in the extremities, particularly on one side of the body, can serve as a warning sign preceding a stroke. These symptoms may appear during a TIA, which is a temporary condition involving reduced blood flow to a part of the brain. This sudden numbness or weakness typically impacts a single body part, such as an arm, leg, or one side of the face, resulting in decreased sensitivity. Although these symptoms often endure for just a few minutes to a few hours, they should never be disregarded. Prompt medical investigation is essential, whether they signal a stroke or another neurological issue. Symptom number 6, speech problems. A person on the verge of having a stroke may suddenly experience difficulty speaking. This can appear as slurred speech, challenges in articulating words, or difficulty forming complete sentences. These difficulties are classified under aphasia, which is defined as impairment in understanding, formulating, and expressing speech. Symptom number 7, neurological problems. Individuals on the verge of a stroke, whether hemorrhagic or ischemic, might display various neurological symptoms. These can encompass memory problems, loss of balance, as well as nausea and vomiting. Such symptoms may emerge a few days or even weeks before a cerebral event. However, it's essential to bear in mind that various other conditions can also present similar symptoms, which can complicate the diagnosis process. Conditions such as migraines, seizures, hypoglycemia, encephalitis, brain tumors, anxiety attacks, and infections in the central nervous system, for instance, can all trigger these symptoms. Therefore, it is crucial to seek advice from a qualified doctor for a thorough evaluation to accurately determine the cause of these symptoms. What is the difference between ischemic stroke and hemorrhagic stroke? The disparity between an ischemic stroke and a hemorrhagic stroke stems from their respective causes and impacts on the brain. An ischemic stroke arises when there is a blockage in the blood supply to a portion of the brain. This obstruction may result from a blood clot originating elsewhere in the body and migrating to the brain, or from plaque formation within the brain's arteries. A common example of a condition that can result in such clot formation is atrial fibrillation. This form of heart arrhythmia disturbs the usual smooth blood flow through the heart. When combined with other factors, it can markedly elevate the risk of clot formation within the heart chambers. These clots may subsequently travel to the brain, precipitating an ischemic stroke. Typically originating from the heart, these thrombi often migrate to the brain, resulting in an ischemic stroke. Therefore, atrial fibrillation is a form of cardiac arrhythmia associated with ischemic stroke. In instances where obstruction occurs due to plaque, there is an accumulation of fat and the formation of atherosclerotic plaque, which obstructs blood flow within the brain. This scenario may occur in individuals with elevated cholesterol, high blood pressure, diabetes, and those who smoke. When blood fails to reach a specific area of the brain, the cells in that region may become deprived of oxygen and nutrients, potentially resulting in brain injury. This type of stroke is the most common, accounting for 85% of all cases. In a hemorrhagic stroke, blood leaks into the brain. This occurs when a blood vessel in the brain ruptures, causing blood to spread to areas where it shouldn't be. The blood leakage can exert pressure and damage the surrounding brain cells, leading to various complications. In summary, an ischemic stroke involves a blockage in blood flow, whereas a hemorrhagic stroke involves blood leakage into the brain. Both types of stroke are severe and necessitate immediate medical attention to mitigate future damage. A common cause of a hemorrhagic stroke, which involves bleeding, is a cerebral aneurysm. Is it possible to detect a cerebral aneurysm before it ruptures? Cerebral aneurysms are abnormal dilations in brain arteries, resembling bubbles in the arteries. There's a risk that they may weaken and rupture, posing a significant danger. Often, a cerebral aneurysm doesn't exhibit any symptoms until a rupture occurs. Suddenly, an individual may experience a ruptured cerebral artery, leading to a hemorrhagic stroke. This scenario can unfold in numerous cases. Nonetheless, there are certain signs and symptoms that can also suggest the presence of a cerebral aneurysm. It's crucial to understand that if you suspect a cerebral aneurysm, prompt medical attention is essential because the rupture of an aneurysm constitutes a medical emergency. However, not all aneurysms rupture, and many individuals live with them without experiencing any issues. There are numerous people who have a cerebral aneurysm without realizing it. Nonetheless, it's vital for you to be aware of its existence. How can a brain aneurysm be identified? When a physician suspects a cerebral aneurysm, they may order specific tests such as CT angiography, or cerebral arteriography to assess whether the aneurysms are at risk of rupturing and require treatment. For those wondering if it's possible to diagnose an aneurysm, indeed, there is such a possibility. As most aneurysms are asymptomatic, investigation typically occurs when there is a family history. Hence, it's crucial for your first-degree relatives to undergo evaluation. How can strokes be prevented? Manage your blood pressure, regulate blood glucose levels if you have diabetes, maintain a healthy weight, engage in regular exercise for at least 150 minutes per week, and consume fresh, nutritious foods. Avoid processed foods, limit sugar intake, reduce saturated fats, and moderate alcohol consumption. Consider quitting smoking if you smoke. Ensure adequate sleep, control cholesterol levels, and keep up with regular checkups with your cardiologist. Following these measures can help prevent a potential stroke in the future. If you enjoyed the video, please consider giving it a thumbs up as this topic is of public interest. Feel free to share it with your loved ones. If you're new to our channel, don't forget to subscribe to support our growth and hit the notification bell so you don't miss out on our next video. We're curious to hear from you. Were you aware of these silent signs of a stroke 1 month before it happens? Share your thoughts in the comments below. Before you go, you may also find some other helpful videos popping up on your screen. Feel free to click on any of them, or even better, watch both to continue your knowledge journey with us. Thank you so much for watching. See you in the next video. Goodbye.